think my path to becoming a doctor was a little bit unusual. I started out in pharmacy. I was always a science guy and liked sciences. My father was a pharmacist, and then once I started working in summers as a pharmacy intern, I realized I really kind of wanted to be a doctor, not a pharmacist. Ophthalmology is something that I was always a little bit interested in. I wanted to be a surgeon, but I really enjoyed patients too, so I wanted to be able to see patients and interact with patients. But what really sold me was at the University of Minnesota, where I went to medical school. The ophthalmology people were really the happy people. They liked their job, they enjoyed things, and that's really said, hey, I want to be a person like they are. I want to be happy. When I was doing ophthalmology and deciding did I want to do a fellowship, oculoplastics was something that allowed me to put things back together. When I was a medical student and an intern, the thing I enjoyed the most was working in the emergency room, and people would come in Friday night, Saturday night with lacerations that needed to be sewn up, and that was really my favorite part. And so oculoplastics gave me that ability to recreate or put things back together. Yeah, I think in oculoplastics I probably enjoy doing eyelid work the most, droopy eyelids, eyelid cancers, but there's other things that I find the most challenging, I think, is thyroid eye disease, which is an entity that we're still trying to treat better and find better treatment for. And finally, lacrimal surgery I do jointly with the otolaryngology people at Jefferson. And we do endoscopic surgery. We make no incisions, and that's really something that I think as patients enjoy, and a better way to treat patients. We're fortunate at Wills to have a large number of doctors, and they do diverse things. We have people who do mostly cosmetic surgery, and we have people who do mostly very big surgeries, including tumors and big reconstructions. We have a nice relationship with Jefferson. Both neurology, neurosurgery, and otolaryngology. We do a lot of joint surgeries involving tumors and trauma-type reconstructions with their services. First, I chose Wills Eye as a resident. This really was and still is the top residency in the country, and I was fortunate enough to be able to come out here. When I came out to Philadelphia from where I grew up in North Dakota and Minnesota, I actually had a job to go back to in North Dakota and had every intention to go back. But I came here, I realized what Wills was, the great atmosphere, both as a resident and now as a doctor. It really is a family-type atmosphere. Everybody enjoys being with each other, and that's really why I stayed at Wills and still am here.